Hi, I'm Dr. Shahzad, board certified family practitioner, previously clinical assistant professor, University of Kansas. I also had special training in stem cell therapy with fellowship in regenerative medicine from University of Washington, St. Louis, Missouri. Today I'm going to talk to you about basics of stem cells and also what is the value and what and how we can use it in different modalities in the form of different therapies. First of all, we are going to talk about stem cells and what is stem cell therapy. Stem cells are cells that have the incredible ability to develop into different cell types in the body. When a stem cell divides, it will either stay as stem cells or become another type of cell that has a specialized function such as red blood cells or muscle cells. Stem cells replace functional cells that are damaged or abnormal. Stem cells do this by dividing multiple times to create new cells. These new cells replace the damaged or abnormal cells such as blood cells or muscle cells. Stem cell therapy is the process of gathering cells from an area where healthy cells are abundant and injecting those healthy cells into an area of the body where they are damaged or aged. Now we are going to review some of the articles which are present and going to see that where are the different applications of stem cells. When we look into different research papers, so one of the paper, it's talk about the safety and tolerability of stem cells. One of the journals called Journal of Clinical Medicine Research. It mentions with the heading of autologous stromal vascular fraction in the intravenous treatment of end-stage chronic obstructive pulmonary disease. Adipose tissues was harvested using a standard liposuction technique followed by SVF isolation and intravenous infusion of 150, almost like 150 to 300 million cells. Out of 12 total patients, only one patient experienced some side effects from liposuction where they showed some bruising. There is another study about COPD which was shown and printed in the clinical use of regenerative therapy in COPD in International Journal of COPD. It was published in December 12, 2014. Animal and human studies have demonstrated that tissue-specific stem cells and bone marrow-derived stem cells contribute to lung tissue regeneration and production, and thus administration of exogenous stem cells and progenitor cells or humoral factors responsible for the activation of endogenous stem cells or progenitor cells may be a potent next-generation therapy for chronic obstructive pulmonary disease. In another research paper by Liu at Arthritis Research and Therapy 2010 with the title of Therapeutic Potential of Human Umbilical Cord Mesenchymal Stem Cells in the Treatment of Rheumatoid Arthritis. In the conclusion, it mentions human umbilical cord mesenchymal stem cells suppressed the various inflammatory effects of fibroblasts like synoviocytes and T cells of rheumatoid arthritis in vitro and attenuated the development of CIA in vivo. Strongly suggests that UC, that is umbilical cord MSC, might be a therapeutic strategy in rheumatoid arthritis. Likewise, another study which was published in 2018 in the Japanese Society of Regenerative Medicine, mesenchymal stromal cells as a potential therapeutic for neurological disorder. This is very interesting and detailed articles which is discussing about the neurological disorder. They talk about spinal cord injury, and here it mentions a recent study reported the safety of intrathecal injections of autologous bone marrow mesenchymal stem cells in 9 patients with spinal cord injuries. In this study, patients received 2 or 3 injections with a median and no treatment-related adverse event was observed. In another condition is called amyotrophic lateral sclerosis, which is ALS. Reported 2 repeated intrathecal injections of autologous bone marrow stem cells were safe and feasible for ALS patient. In another condition is called spinocerebellar ataxia. Reported intravenous and intrathecal infusions of allogenic umbilical cord mesenchymal stem cells was performed with no serious transplant-related adverse event, and the majority of the patients showed improved Berg Balance Scale and International Cooperative Ataxic Rating Scale, scoring continue for at least 6 months. And also cerebral palsy. Recently, stem cells are emerging as a new treatment and possible cure for cerebral palsy. The result indicated that bone marrow mesenchymal stem cells transplantation of treatment of cerebral palsy is safe and feasible.
नाजरीन, अगर आपको मेरी वीडियो पसंद आई हो तो मेरे चैनल को सब्सक्राइब करें और बेल आइकॉन को क्लिक करें ताकि आपको मज़ीद इस तरह की इंफॉर्मेटिव वीडियो मिलती रहे। शुक्रिया।